moved to Peachtree City around 7 years ago. I had an implant put in, a sequence of 3 implants on my lower right jaw, where within 3 years, they started moving within the bone. When I came to Dr. Anderson, I was feeling a fair amount of pain, and that's when he told me that the implant actually was outside of the bone, just being held by the gum line. Once you want to put in an implant, and if you don't have enough bone, there is a small procedure that you come for Dr. Anderson for. He will, it's kind of like a minor surgery. He will put a synthetic piece of bone, closes it up, you'll have a couple stitches, and then patiently you have to wait about 2 or 3 months for the bone to grow, at which point he will tell you that you are now ready to receive the implant. I have a high tolerance for pain. I was not put under in any of these surgeries. I'm not the norm. If I wanted, I could have had general anesthesia for 30 minutes and wake up, everything would have been done. If I'm still nervous about that, then he gives me gas, relaxes me, and then continues. So there's all kinds of approaches. He exceeded my expectations. There was so much trauma done to my jaw because of that failing implant, and there was numbness that I felt for about 8 years. I was not expecting this great result. I was willing to settle for way less. You need a certain amount of bone in order for the implant to last as much as it can last. So for me, it's very simple. Even if you're almost there, but you don't quite have the bone that you need, it's an investment. It's the foundation for the success of the implant. So if Dr. Anderson tells you that you need to have a bone graft, don't cut that corner and say, no, you just put the implant, because you will be coming back to start all over again. You will have to remove the implant, do the bone graft, and start all over again. And the only part that you can save on that process will be the crown. A stable, strong bone is absolutely imperative for the success of the implant.